So hi, everybody, and welcome to our monthly geriatric addictions rounds on addressing the knowledge gap of cannabis in older adults in Canada. My name's Anna Culler, and I'm a registered nurse with CMHA. I would like to thank the following for making this event possible: the Canadian Mental Health Association of Waterloo Wellington, St. Joseph's Health Centre in Guelph, Behaviour Support Ontario, Centre for Addictions and Mental Health, and Baycrest Hospital BSO. A few housekeeping reminders. This session is being recorded. Please ensure that your respective host venues are not broadcasting any client-specific information to those who are already on our mailing list. We have the link available for you for this recorded session no earlier than a week from today's presentation date. We have muted all your microphones for the purpose of this session, but kindly recheck them and mute them if not. You will be given the opportunity to raise your questions at the end of the presentation if time allows. Feel free to unmute your microphones and ask your questions, or type them into the chat box to the side of your screen. I'll also take a moment here now for our land acknowledgement. While we connect virtually across regions of Ontario, we would like to acknowledge that each of us resides on a specific ancestral homeland. I'm speaking to you from the CMHA Waterloo Wellington offices in Guelph on the traditional land of the Anishinaabe and Mississaugas of the Credit First Nation, and in the Fergus, Cambridge, and Waterloo offices on the Haldimand Tract, traditional homeland to the neutral Anishinaabe, Haudenosaunee, Seneca, Tuscarora, Odaga, Odena, Mohawk First Nations, past and present. We honor with gratitude the land itself and the people who have stewarded it throughout the generations. This calls us to commit to continuing to learn how to be better stewards of the land we inhabit as well. This acknowledgement is a simple, powerful way of showing respect and a small step towards correcting the stories and practices that erase Indigenous peoples' history and culture across Canada and here locally, and towards inviting and honoring the truth. We're deeply committed to the truth and reconciliation process. I want to hand things over now to Marilyn White-Campbell, my colleague, who works with BSO, to introduce our speaker today. Marilyn, you're on mute.
Well, good afternoon. Thank you, everyone, for coming out this afternoon. I want to introduce you to a very respected and beloved colleague, Dr. David Kahn. He's the Executive Vice President of Education in the Baycrest Academy for Research and Education. He's a professor in the Department of Psychiatry at University of Toronto and a founding co-chair of the Canadian Coalition for Seniors' Mental Health, which is responsible for the development of the National Best Practice Guidelines. And I think this project, David, is an offshoot of that project. And he is the past president of the Canadian Academy of Geriatric Psychiatry. I want you to give a warm welcome to Dr. David Kahn.
Great. Thanks, Marilyn and Anna, and appreciate the invitation to speak today, and thanks to the collaborative. You do really great work, and it's really wonderful that you have these wonderful rounds every month. So I'm going to be talking about the knowledge gap in cannabis in older adults in Canada today, and particularly focus on a series of e-learning modules that we've developed. It's taken us more than 2 years to develop them, but they're out and available now as of last month, and proven to be pretty popular. We actually have over 600 people already who've registered and are working their way through the modules. So we're excited about that. In terms of any disclosures, just to note that I have funding for a number of related projects. So Marilyn mentioned these are mostly through the Canadian Coalition for Seniors' Mental Health. So there was the development of our national guidelines. And then this particular project on cannabis use in older adults. And I've been a collaborator on a number of other related projects funded by the Alzheimer's Society, Mental Health Commission of Canada, and CIHR. And I think the other disclosure is to say that this whole area is one that we don't know enough about. And in preparing these modules, we realized just how little we know. So the one thing we're going to have to do is keep updating them. So it was Health Canada who provided the coalition with the grant to develop these modules. And the views expressed herein do not necessarily represent the views of Health Canada. Lots of people to thank, and this is really a team effort. And so the folks you see up here on the screen were either members of the steering committee or the scientific planning committee or both. And some really, really excellent people here who've devoted a lot of time and energy into this project. And these individuals were actually the authors of the various modules. So for today, I want to describe the process to identify the gaps in clinician knowledge and expertise regarding cannabis in older adults, describe the process for creating these modules and associated resources, and then summarize highlights from the e-learning modules and resources available. So we'll take just a quick sort of drive through, very quick, just so you see what's in the modules, but we won't have time to really delve deeply into them. But we will share a couple of case examples, because there's a number of case vignettes all the way through these modules. Okay, so the first learning objective, describe the process to identify the gaps. So why is cannabis in older adults important, according to the scientific literature? So these are from recent studies, but so Canadian physicians reported that they felt their knowledge of medical cannabis was lacking, and their comfort authorizing cannabis might increase with additional education, particularly in the areas of dosing, treatment planning, the relative risks and benefits. So that was a study of physicians, and then a similar study looking at nurse practitioners who are able to authorize cannabis use, also said that educational programs are needed to address these knowledge gaps and the clinical barriers that they face. And then medical students, 75% expressed an interest in more education in order to improve standards of care. And then finally, limited provider knowledge has also been identified in surveys of patients where perceived physician discomfort with cannabis-related communication has been identified as a barrier to effective communication between patients and providers. So quite a lot of background information from various surveys to suggest that there's an issue. So when we started this project, we decided to do a needs assessment, a survey. It was an anonymous survey distributed through emails in the fall of 2020. And we sent it out to large groups of these individuals here. So physicians, nurse practitioners, other healthcare providers, students, healthcare students, older adults themselves, and then some older adult caregivers. And we were fortunate that we had over 1,500 respondents, including almost 200 physicians, 43 nurse practitioners, more than 500 other healthcare providers, and then some students, and then a lot of older adults themselves who must have felt that this was an important survey. So some of the results. So the majority of healthcare providers are certainly aware of older patients using cannabis, and that older adults do not always feel comfortable talking about cannabis with their healthcare providers, and want their healthcare providers to be more knowledgeable, and then a strong interest from healthcare providers. So yeah, so almost all physicians, nurse practitioners, and most other healthcare providers are aware of older adults in their practice using cannabis. And I'm surprised it's not 100%, because the use of cannabis now is just so prevalent, even among older adults. It's quite surprising now. As long as you ask people, you'll get an interesting answer. But if you don't ask, they're not going to bring it up mostly. Despite this, only 39% of physicians and nurse practitioners and 26% of other healthcare providers feel strongly or very strongly that they have sufficient knowledge and expertise to address older patients' questions about cannabis. So, the vast majority do not feel that they have sufficient knowledge or expertise. Students, of course, the majority said that they haven't learned about cannabis at all in their curriculum. And again, they've interacted, about 2/3 had already come across older adults who use cannabis. So certainly cannabis consumption among older adults is going up quickly in recent years. And obviously with legalization, this is having a significant impact as well. And it turns out that the rate of increase is faster than in other age groups. So older adults are signing on more often now and at a quicker pace in terms of growth of use than other age groups. And that's interesting to think about why that might be the case. And certainly, there is a knowledge gap based on the data then presented there. And the other thing is stigma, right? So there has been a lot of stigma around cannabis, obviously based on the history and the fact that it was generally an illegal drug for many years. And so, that kind of stigma has a significant impact and something we should bear in mind, and it still exists. So some patients may be quite reluctant to bring up the fact that they've been perhaps say heavy users of cannabis over the years. These were some interesting testimonials that from because there was an opportunity for in the survey to just make comments, and these were interesting. These came from a variety of individuals. So one said the cannabis can be helpful if used in the appropriate ways. I feel that doctors and healthcare providers don't always know or want to know all of the facts about cannabis, and therefore dismiss having a fact-finding conversation with their patients. A caregiver says, excuse me, my concern about discussing cannabis with a doctor or healthcare provider is fear of being thought to be irresponsible or a bad caregiver. Another caregiver writes that it seems that stigma or fear may be getting in the way of trying an alternative for my family member. Another older adult says, I discovered the value of cannabis for my arthritis. However, my doctor refused to provide a prescription because she said there was no guidance on recommended dosage. Yeah, so do you ask your patients about cannabis use? Probably this group you do, because you are working in this field. But if you think about the larger healthcare system and our colleagues out there, the answer I think might be quite different compared to this group. And of course, we're interested in asking people, why don't you ask? Or if you do, that's good. But if you don't, why not? The survey revealed that when it comes to older adults and how they get their information about cannabis, so 45% get their information from the internet, 40% from physicians. There's overlap here because people could choose more than one answer. 34% from family or friends, and 24% from the media. So interesting. Do you have concerns about that? What do you think? 51% of older adults stated they had talked to their doctor about cannabis. That's amazing, like just over half. Of those, 41% of those stated their doctor was unable to answer their questions. 54% of older adults who responded who use cannabis do so with a prescription or medical authorization from their physician or nurse practitioner for medical therapeutic reasons. 25% said that they use cannabis for non-medical reasons, meaning for recreational use. And when it comes to the reason for using cannabis, the three top reasons were, number one, pain, so chronic pain. Number two, to help sleep. And number three, to help with anxiety. So pain, sleep, and anxiety. And one question to ask is, does cannabis help with these three particular symptoms or problems? And what's the evidence? Would we recommend cannabis for these conditions? When it came to the concerns of physicians and nurse practitioners related to cannabis in older adults, their top concerns were interactions with other medications, so drug interactions, chronic adverse effects, so what could those be? Acute adverse effects, intoxication or impairment, legal considerations, interesting, and effects on driving, and that's certainly a big issue, quite a controversial one at the moment. So we're going to move on to learning objective number 2. So that's describing the process for creating these modules and resources. So yeah, it's taken us quite a while, but I think we wanted to do it well. So we started out by identifying a steering committee. We conducted scientific and gray literature reviews in great detail. We were assisted by a group in Ottawa who'd done a fantastic review of this area, who gratefully provided us with their access to their information. And Kim Carras, who's was a member of our scientific planning committee, was a member of that group with Brian Hutton. So yeah, so the next thing we tried to do was obviously identify a scientific planning committee. So that's a group with sufficient expertise, and we put together a really great group. The majority of the folks on the scientific planning committee were also subject matter experts and were authors of the modules, but not all. Some provided support, expertise, and reviewed our material. Next thing we needed to do was to hire an e-learning developer, an identification of a learning management system. So I work at Baycrest, and we have a great team at Baycrest, small but mighty. So Kat Nemethy is our manager of e-learning, and she became highly involved in this project with her colleagues, and we had fantastic support in putting this together. So, you know, we did the needs assessment that I've just presented about, the established learning objectives for each of the modules. Then we went through the lengthy process of applying for accreditation, particularly for physician specialists and family doctors, and that was done through the University of Ottawa. And then, of course, we created the modules, and that took a long time. It's a challenging process, and one of the things about e-learning modules, you've really got to figure out what do you know and what you don't know, because it's there in black and white, you know, or actually in color. But and this is an area where there's an awful lot we don't know, so we have to be careful about what we actually put into the modules. And, so we created the modules, we've translated them into French, so they're available now in English and French. Actually, the French modules are just going to be launched, I think it's next week. And then we've also been working on a toolkit with some extra resources for clinicians and patients. And on our with our subject matter experts, we had colleagues from geriatric psychiatry, family medicine, nursing, pharmacy, and a medical student as well. Yeah, so the learning objective number 3 is to summarize some highlights from the e-learning modules and resources available. So yeah, so these are the module titles. I'll read them out and then we'll go through them one by one. But on the right is the number of credit hours you can get for continuing education points that various professions need for their ongoing certificates of ongoing learning. So the first one is actually looking at the reality of cannabis use in older adults. Then we move on to discuss the history of cannabis and the current status of Canadian cannabis legislation and policies. We look at regulations, provincial territorial guidelines, medical legal considerations, etc. And rather than reading these now, actually, I think we'll just go through each one with some images of the modules themselves. Yeah, and I mentioned that this was a partnership between the CCSMH and Baycrest to host the modules. So you can access the modules. I'll give you information at the end about how to get into them, but you can access them through the CCSMH website is the best route in. So you go onto our website, which is www.ccsmh.ca, and then you can find the link, and then you go in to the Baycrest Learning Management System. You have to answer a few questions, and then you see this screen here. And as you'll see, there's a variety of the different modules. And if you put your pointer over each one of these, it will show you what the topic actually is. There's also an initial module on just how to navigate through the modules themselves. And so module one I mentioned is the reality of cannabis use in older adults. So it includes national data on cannabis use and the reality of its use across Canada. Some information based on the knowledge gap and stigma. Some of that reflects the survey that we did. And then Canadian sources of cannabis information. And there's quite a few testimonials as well from the survey included in this first module. Yeah, and then we go into the history of cannabis and the current status of Canadian cannabis legislation and policies. So I actually worked on the history of cannabis, which was fascinating, reading the history going back thousands of years, because cannabis has been used both medicinally and for recreational purposes for thousands of years, probably initially in China and other parts of Asia, but its use spread across the globe through India into Europe and into North and South America. And it is fascinating. It's very interesting to look at some of the early reports that appeared in medical journals, for example, in the 18th century. And so we have some examples of that in this module. It really makes for very interesting reading. And it was interesting that even several hundreds of years ago, physicians were really aware of the fact that this was a powerful drug and that it could be therapeutic. And some of the conditions for which it's considered a possible indication today were being identified way back then, which is quite fascinating. Linda Balneves is one of our authors. She's a professor of nursing who's extremely knowledgeable about this area. And she wrote the sections here on legalization, both of non-medical cannabis, most recently, as well as medical cannabis, which goes back further. And there's details about the Cannabis Act, the federal act that legalized cannabis in 2018. And you can find out more about that, and as well as looking at your own province's regulations, because they vary from province to province, in fact. Yeah, and then the next section actually goes into this in more detail. Again, as I was trying to say earlier, you might say, I'm really not interested in these kind of regulations or this kind of thing. It's not that important for me. In which case, don't do them, just skip them and go on to the areas that you would find most helpful to you in your practice. But we think, of course, that if you complete all of the modules, that your overall learning will be enhanced and you become a true expert in this area. So, and then within this module, there are specific guidelines for physicians, for nurse practitioners, for other nurses, as well as some information about institutional policies and ethical considerations and issues around fitness to practice and cannabis use. So something for everyone, really. The next module is on cannabis and cannabinoid neuropharmacology and drug interactions. So how does cannabis work? We all have in our bodies the endocannabinoid system, which consists of endocannabinoids, receptors, and enzymes. And this is considered to be a very important system in terms of homeostatic regulation with multiple effects. So the reason cannabis works, of course, is that we have a system in our body that has endocannabinoids. So endocannabinoids being produced by the body. So, and that's quite fascinating if you think about it. But if we didn't have an endocannabinoid system, then cannabis wouldn't do much. We heard in the needs assessment survey that physicians, nurse practitioners were very concerned about drug interactions. So there's a section here on drug interactions and polypharmacy. And then there's a case study that focuses on the issue of drug interactions and the importance of documenting cannabis if we know it's being used. Yeah, and so if you're really interested in drug interactions, then there's quite in-depth details here. The CYP system, the P450 system of enzymes are really important for drug metabolism. And so, as well as a process called glucuronidation and transport proteins. So these are all pharmacokinetic aspects of drug interactions. And many have said, well, we don't know that much about cannabis and drug interactions, and we don't know how significant they are from a clinical perspective. Actually, when it comes to this P450 enzyme 2C9, there's quite a bit of information. And as you work your way through these modules, you click on the arrows here, or right above, next to the arrows, and you get narrated information all the way through, of course. But this is one of the most striking and challenging and difficult drug interactions. And so warfarin, the blood thinner that's used by a lot of our patients, it's a very challenging drug to use, because if you take too much warfarin, you're going to bleed. And that could be very dangerous. As we know, you could have a gastrointestinal bleed, a cerebral bleed. This is really serious. So, and it's why we measure the INR regularly in people who are on warfarin. And we realize that that drugs, even foods, can have an impact on the warfarin level in the body. And if, again, we want to avoid either too little or too much. If there's too little, it's not going to have the effect of preventing strokes or heart attacks. But if there's too much, it's really dangerous. Turns out that CBD is an inhibitor of the enzyme CYP2C9. And so that could cause an increased effect of the warfarin, increased INR, and bleeding. And so if somebody's going to start using cannabis, pretty good idea to get keep a very close eye on their INR. So this is the kind of thing that's in the modules that's like really, really important clinically. As well as pharmacokinetics, there are pharmacodynamic changes. And again, here there are effects of THC and CBD on various symptoms, various problems that we might see with more information about these in the modules. So the module 4 goes into quite a lot of depth about the science of the cannabis plant. What do we know about it? There are all these different strains of cannabis, different families of cannabis, indica and sativa, the ones that are best known. But there are, within cannabis, there are many different forms of cannabinoids and what's called terpenes. So this module goes into some depth, including sort of futuristic information, because, you know, although CBD and THC are the ones that jump to our minds because they've been the ones most studied and we know the most about those, there are a whole variety of others that are now being researched. And the thing is, in a way, cannabis really isn't one drug, it's multiple drugs. And that's what makes it all very complicated and challenging. You know, and why, it could be one reason why some people prefer to smoke cannabis, because they're getting a whole variety of different cannabinoids when they do that, not just the sort of pure forms of THC, CBD, or a mix of the two that you get with the oils or other forms of cannabis that's available. This module also has a section on cannabis research, explaining why it's been a challenging area and why it is a challenging area to research, emphasizing the fact that we have a long way to go, and that there's a lot of research going on at the moment. I think it's around over 300 different clinical studies going on with cannabis that are registered with the government agencies in the US, which is kind of an international registry of ongoing drug trials. So module 5, very important. So what is the evidence for cannabis as a form of medical treatment? I worked on this one with one of my colleagues, Kieran Ribeiro from Ottawa, and it was challenging. It was really challenging because how much evidence do you need in order to back something up? Is it enough that there's a lot of anecdotal reports? Let's say a lot of patients say cannabis really helps, but for this particular issue, but the research isn't there, the studies aren't there to back that up. So how do we advise people in that regard? Or maybe there's just a hint. There's been one study that sort of shows something, a signal of some benefit. When we looked at the various disorders, we broke them down into different categories of mental disorders, chronic pain, other disorders of late life, and other symptoms. And we went through them all methodically, and we used guidelines, existing guidelines. So there's guidelines produced by the Journal of the Canadian College of Family Practitioners. There's similar evidence from documents from the United States. So we did pay a lot of attention to those existing guidelines, and the data from those guidelines is built into these modules. But basically for each area, we briefly describe the findings in the research literature. We actually try to come up with a bottom line that we think might be useful. We give references, and then we also provide the data from these various guidelines. And then within this section, we also talk about key considerations for older adults. So, particularly around the susceptibility to adverse effects, general contraindications, and being aware of high dose reversal of effects. So this is interesting. With cannabis, with a low dose versus a high dose, you can get opposite effects. So for example, with anxiety, high doses can make anxiety worse, but there's some evidence that low dosage may be beneficial for anxiety. For low dose can help nausea, but particularly associated with chemotherapy, but high dose, too much, can actually cause hyperemesis, where people are vomiting a lot. So it's an interesting drug or group of drugs for that reason. Module 6. So this is coming to what's available and what kinds of cannabis can we use as forms of treatment. So there are 2 pharmaceutical grade cannabinoids. So they're produced in the same way that any other pharmaceutical drug is produced. And one of those, the best known of those, is nabilone, which is a synthetic THC analog. So it's pretty much all THC, or a synthetic form of THC. So we describe its use, including the formal indications from Health Canada. And then the other is nabiximols, which is actually a combination of THC and CBD. Within this module, there's information about the pharmaceutical cannabinoids, and then lots of information about non-pharmaceutical cannabis, including how to dose it. So this would be, for example, oils or capsules, or there are many different forms of this. The oils are the most popular right now. If you go to a medical cannabis clinic, then you're most likely to be prescribed an oil. And then this chapter, this module also discusses different modes of cannabis use. And there are so many right now, one's losing track of them, but including edibles, of course, and all of the challenges that come with edibles. And then how to actually access cannabis. What are the options? We see retail cannabis outlets open by the hundreds. I think I read that there was 1,800 retail outlets in Ontario. In the neighborhood where I live, they're almost on every corner. It's incredible. And then sometimes they close and another company moves in. But I gather in the news that the overall use of cannabis is actually sort of evened off or even declining a little bit at the moment. There's information about, if you go to a clinic and then you get registered with a licensed producer, how you actually receive it, and the costs and so on. Yeah, so this would be the information, for example, on nabilone within that module, noting that Health Canada specifically says that it's a third-line treatment option for the management of severe nausea and vomiting associated with cancer chemotherapy. So that's very focused, very specific. And by third line, it means that only after other options have not worked. But there are other off-label indications, meaning the physicians can, or nurse practitioners could use it for other conditions, such as palliative pain, neuropathic pain, and AIDS-related anorexia. And then information specific to older adults runs all the way through these modules, often noting that there's as little evidence as there is for the population in general. There's always even less research specific to older adults. This would be another image from that same module where it specifically goes through, the actual titration, how these oils should be used, dosing, and so on, which may be helpful again for some people. Again, some people using these modules may actually be authorizing and therefore need this information. So module 7, adverse effects and special considerations for safety. Obviously, this is really important for older adults. So you can see there's sections on driving, falls, polypharmacy, traveling with cannabis, and so on. And further sections here on harm reduction. So the idea that it's possible, there's some evidence that cannabis might be used to decrease the use of other substances such as opioids. And the evidence isn't that strong, but there's some evidence. And so that's described in this module. And then there's a focus on cannabis use disorder. So the actual use disorder that was focused, that we focused on in our previous guidelines. And so there's summaries of those guidelines in this module. And now module 8 really gets into collaborative patient-centered care and communication strategies that are so important. Noting just through case examples of why a collaborative approach with multiple levels of communication is really important. Yeah, so right now I'm going to just shift out from here and hopefully show you from one of the modules some information.
Recognize that discussing cannabis use or potential cannabis use may be an uncomfortable conversation for some. This reluctance may stem from worrying about how they may be perceived, embarrassment, cultural expectations, or legal concerns, to name a few. Do you engage in the following techniques in order to support your older adult patients in making informed decisions? Reflect. Given that, do you
Yeah, so this is a case example, and this is Mr. Park. So he's 92, living on his own. He's a history of chronic back pain and laminectomy. He's on multiple medications that you can see listed there, including hydromorphone contin, gabapentin, nortriptyline, duloxetine, so quite a lot of medications for pain. Despite this, his pain is not controlled. And this is Dr. Neil, who's a family physician.
Because you're having difficulty with back pain?
That's right. I've got severe back pain and I can't fall asleep.
Oh, I'm sorry to hear that. I'm wondering if we might start by reviewing the dosages of your current medications.
Well, on that, my kids suggest use of cannabis. Do you think that would be any good for me?
Oh no, I just don't know enough here and I don't have any time to do the research. And anyway, I'm not convinced of cannabis use in older adults. I'm shutting this down now. Well, Mr. Park, cannabis may improve pain complaints for some people, but quite frankly, I don't recommend it for my older patients, people like you. The reason for that is because the evidence, despite what your children may read, is actually quite sparse. And I simply don't feel comfortable recommending it. So let's just start with increasing your current medications, shall we?
Okay with me, whatever you say.
So the question is, was that a good way to deal with this or not? And so what we have next is an alternative
Though this scenario
approach.
may seem exaggerated, the results from the CCSMH Needs Assessment Survey indicate it is not uncommon for older adult patients to feel unsupported, uncomfortable, or dismissed when attempting to discuss cannabis. Acknowledge that speaking about cannabis can be uncomfortable and convey thanks for bringing it up. Click play to watch an alternate scenario where Dr. Neal uses the ARC framework.
Mr. Park, I understand you're here because you're having difficulty with back pain?
That's right. I've got severe back pain and I can't fall asleep.
Oh, I'm sorry to hear that. I'm wondering if we might start by reviewing the dosages of your current medications.
Well, on that, my kids suggest use of cannabis. Do you think that would be any good for me?
I don't know enough about this topic yet. I think I'm just going to take a minute, breathe, and then check in with Mr. Park about what he knows about using cannabis for pain. We're going to figure this out together. Thanks so much for bringing this topic up, Mr. Park. I know for some people it can be really uncomfortable, so I really appreciate that you felt that you could discuss it with me. Can you tell me a bit more about why you're considering cannabis?
I don't even like the idea of any more drugs at all. There's so many I'm taking.
Review your patient's motivations for considering cannabis. Click play to watch an alternate scenario where
That's very helpful for me to know, Mr. Park. I'm not sure if you're aware of this or not, but cannabis is actually a drug.
Oh,
Can you tell me if you've used cannabis in the past?
well, a long time ago, I went to parties and we smoked these joints, but I haven't done anything like that in a long time.
Dr. Neal uses the ARC framework. Collaborate to determine the most.
That's also helpful for me to know. Mr. Park, I don't know enough about cannabis use for your pain, so I can either look into it further for you or I can refer you to a medical cannabis clinic. What would your preference be?
I would like to come back to you first.
Okay, well, we can arrange another appointment for you on your way out. And in the meantime, I'm going to do some research about how effective cannabis is to control your pain. And then we can discuss what we've discovered at our next meeting. How does that sound?
That sounds good.
Okay. In the meantime,
So yeah, I think we did better the second time round, right? Okay, maybe I'm going to stop there. Whoops. Okay. So the last sections focus more on clinical care as well, and there's a lot of case examples that you can work your way through. In that video, that was the doctor was Kathy Smith, who's a Baycrest educator and does a lot of patient simulation, and the gentleman was one of our volunteers and who works as a simulated participant, and he's really great. So I'm going to stop there, I think, although I should give you information about how to connect.